morning, everyone. Welcome to day 8 of Acharya Rad Connect 2025 of Premier Online Webinar Series dedicated to advancements in medical imaging organized by Department of Medical Imaging Technology, Acharya Institute of Allied Health Sciences in association with Indian College of Radiological Technology. I am Nasreen, your host for today. It is with great pleasure that I introduce Dr. S. Tamijeselvan, Assistant Professor in Radiography at Mother Theresa Postgraduate and Research Institute of Allied Health Sciences in Puducherry. Sir is a distinguished expert in the field of radiography, having more than 23 years of teaching and research experience. As a resource person, he has attended more than 5 international conferences and more than 6 national conferences. Sir has also attended multiple national and international workshops and training programs. Sir has made a significant contributions to research and academics with more than 9 books chapter in the field of radiography. Till date, he has published 16 international journal and 4 national journal. Till date, Sir has been granted 6 patents and 3 patents have been published. Dr. Tamijeselvan's impressive academic background coupled with their extensive publication and patents make him a dedicated professional with a passion for excellence in their field. We extend a warm welcome to you, sir. I request you to kindly begin with the session.
First of all, I am going to take the fusion image, the principles and application. We are going to see the fusion imaging. What is meant by fusion imaging? First of all, it is a hybrid imaging. You are getting combined with the 2 or more imaging modality to find out a new image. So by combining the advantages, the fused imaging technology has the more powerful modality, usually helps the doctors or medicos to get a correct diagnosis. This innovative approaches enhances the image quality and provides a deeper insight into the medical diagnosis. So that is why we are preferring the fusion imaging. The common modalities where we are getting the fused image, where we are getting the hybrid images. Common modality where the fusion imaging are now in practice are the first one is PET CT, PET MRI, SPECT CT, and nowadays the ultrasound based fusion imaging from as an emerging technique. So first of all, PET CT, it is a combining or the hybrid imaging of the metabolic imaging from the PET and the anatomical details from the CT. Likewise, PET MRI, it is the combination of the PET, that is the metabolic image, and the structural image through the MRI. SPECT, it combines SPECT with the CT. First of all, we will go by PET CT. It is as I told you earlier, it is a hybrid imaging modality which combines the PET image and the CT image. It is almost accurate simultaneously. It is a combination of the cross-sectional anatomical information provided by the CT and also the functional or metabolic or physiological information provided by the positron emission tomography. By combining both these plus, that is the advantages, that is structural things from the CT and the functional data from the PET, we will be able to find out a innovative modality to give an accurate diagnosis. First, we will see about the PET and CT separately, and then we will come to know how these 2 modalities are getting combined to get a new images. First of all, what is the PET? It is nothing but positron emission tomography. Positron means it is an antiparticle, or you can say the counterparticle of the electron. Since the electron is having the negatively charged, the positron is having the positively charged. Then emission, what is the emission? It is a particular type of radioactive decay or subtype of beta decay in which A proton inside a nuclei is converted into neutron while releasing a positron. A proton means it has the positive charge. It is converted into neutron by releasing its positive charge out. That positively charged ejected particle is called positron. Tomography, will be knowing tomography is the cross-sectional radiography. So all put together, positron emission tomography. We are taking a tomographic image or cross-sectional image using the technique of positron emission. The working principle. In this imaging technique, we are using a small amount of radio-labeled biological active compounds, that is called tracers, to help the diagnosis. It is a nuclear medicine imaging that produces a cross-sectional image. The tracers are introduced into the body either by injection or inhalation of the gas. Usually, we are doing the administration of the radio tracer through the injection. And a PET scanner will produce the image. So these are the steps involved in the PET strip. First, we are producing the radio tracer. Okay, it is done by the cyclotron or DNAC, something else. And the second step is the produced radio tracer or radio pharmaceutical is synthesized. Synthesized means we are purifying that particular component. We are removing the unwanted substance. And third step, we are measuring the radioactive distribution, whether the particular radioactivity is there or not for the image. So we are getting measured. And after that, we are administrating into the particular patient. So what are the radionuclides that are commonly used? They are commonly used the PET radionuclide that is called positron emitters. It means it is capable of emitting the positron. As I told earlier, they are produced in cyclotron. Mostly they are produced in cyclotron. Some of the examples are given with the half-life. Usually, while doing a diagnostic study, the half-life should not be very short or should not be very long. It has to be optimal. So it is in the minutes. Okay? So what are the radionuclides we are commonly using? The rubidium, it has the 1.23 minutes of half-life. Fluorine 80, this is the commonly used radioactive isotope in our study. It has the half-life time of 109 minutes. Oxygen sometimes it is 2 minutes. Nitrogen, carbon. So we are using the fluorine 80 in the form of FPG. What is the FPG? It is fluorodeoxyglucose. So that particular radioactive substance is getting combined. It is getting combined with the glucose molecule, so that the metabolism takes place in the particular organ of the uterus. So this is another process where after injecting or after administrating the radioactive isotope into the body, the particular radioactive isotope is getting emitted positron because it is a PET radionuclide. PET radionuclide means it is emitting the positron. That emitted positron is getting reacted with the electron of the particular tissue, and both these electron and the positron. So this is the positron. It is having a positive charge. It is emitted from the radio-labeled nucleus. This is electron, where it is already present in the tissue where we are going to image, that is region of interest. So the electron in the region of interest and the positron from the radio-labeled radionuclide is getting interacted. Both the things are getting interacted. So a positive particle, a negative particle is getting interacted, and both these particles is getting disappeared. After they disappear, what happens? As we know, there is no creation of energy or destroy of energy. One form of energy can be converted into another form. So according to that particular law, the electron and the positron is getting disappeared means it is converted into some other form. So how it is getting converted? The electron and the positron is getting disappeared and forms the energy particle, or you can say it is emitted as gamma photon. It is emitted as 2 gamma photon. That process is said to be annihilation process. So when a particle meets its equivalent antiparticle, they are both destroyed, their mass, and converted into energy. And this concept is said to be annihilation. This annihilation process happens within the body after the injection of the radiography. So the emission takes place, as I told earlier, it is emitted 2 gamma photons of the 511 kilo electron. So these energy particles are getting detected by the detectors. Normally, we are using the bismuth germinating detectors. These detectors convert the radioactivity into light energy. This light energy then converted into electrical signals by the photomultiplier. These signals are getting amplified, reconstructed to give a clear image of the metabolic. So this is the thing happening inside the PET. So I'm giving it in a flowchart manner. It means in first step, we are administrating the radionuclide into the body. Then the radionuclide is getting absorbed by the particular part or region of interest. So in that particular region of interest, it is going and depositing. The radionuclide is getting emitted. What it is emitted, it is emitting the positron. So the positron is getting emitted by the region of interest by the radionuclide. Okay. So next step is the emitted photon is getting annihilated with the electron of the region of interest. So that is called annihilation process. The positron and the electron is getting interacted. Both these particles are getting disappeared, and production of a pair of 511 kilo electron photons are produced. These are gamma photons. The gamma photons, a pair of gamma photons produced by the annihilation process, is getting absorbed by the detector crystal. What is the detector crystal we are using? We are using a scintillation crystal. Scintillation crystal means the gamma energy is converted into light energy. So the detector crystals are capable of converting the gamma energy into light photons, the gamma photons into light photons. So the 511 kilo electron volt photons are converted into light signals. These light signals are getting detected by the photomultiplier. Photomultiplier tube is a combination of photocathode and photomultiplier tube. This photomultiplier tube converts the light energy from the detector into electrical signals. Again, energy conversion takes place. These electrical signals are converted into image by the use of reconstruction algorithm. So that is the process, that is the workflow happening in the PET scan. Okay. Now we are going to see how the image is getting formed in CT. I don't want to go in detail with the CT image formation because you all know how the image is getting formed in CT. Just a flowchart to revise that particular thing. There is the X-ray tube. It is getting emitted the X-ray. The X-ray emitted from the X-ray tube, that is incident X-ray beam, getting reacted with the patient and it is getting penetrated. This is called transmitted beam. The transmitted beam is getting detected with the detectors. There are so much of detectors. Yesterday, sir has told very well about the detectors. So much of detectors are there. Only thing, the detector is the element which convert the transmitted X-ray photons into electrical signals. That electrical signals by the DAS, that is digital acquisition system, it is converted into electrical signals, and by the reconstruction algorithm, it is converted into readable image. That readable image can be displayed on the monitor, or it can be recorded by the multi-format camera, or it can be also recorded by the memory device. So this is the image formation in the CT. So we have seen how the image has formed in the CT and how the image has been formed in the PET. Now we are going to the PET CT, how it is getting used and in the PET CT. In PET CT, there are two gantries are there, as it is shown in the thing. This is CT gantry and this is the PET gantry. Normally, there are some dimension. Okay, the total width of the gantry is about 145 centimeter. Okay, and both the things are getting hybrid. Okay, these are all the components. The PET CT scanners are essentially full ring coincidence detectors and PET portion physically mounted together with the CT system. The PET tomograph are fitted with various crystals that are used to detect the emission of photons, convert them into light signals. The scintillation event to convert the electrical, as I told earlier, is converted to readable image. Usually, the CT scan will be taken first and followed by the that is called PET, that is called what we call emission PET scan. Because of the scanners in the same gantry, the patient remains on a single scanning table. No need to place separate. The patient is staying on the same table. There are two gantries. So first the CT image is getting acquired, and then simultaneously the PET image is getting acquired. After the acquisition, image acquisition, that is CT acquisition is done, and then PET acquisition is done. What happens? The raw data has been sent to the computer. Okay? There, the combination of these raw data by the computer and the image reconstruction algorithm, it will form a fused or hybrid image, which will show both the anatomical part and the physiological part in the case of PET. So this is the thing. This is actually CT transmission scan. Why it is called transmission scan? Because CT, we are using X-ray that is getting penetrated to the body part and it will reach us. So it is called transmission scan. And then this is called the attenuated corrected PET emission scan. So in this image, the structures are clearly visible, but the metabolic thing is not shown as clear in the case of PET. In the PET, controversy, the structure is not shown here, but the metabolic or physiological thing is getting visualized clearly. So here the structure is seen clearly, here the function is seen clearly. By fusing these two images, by fusing the CT image with the PET image, we are getting a newer image which will show the structure as well as the function or the metabolic. So that is the major advantage of the PET image. So in PET image, we are getting both the structural information as well as the functional information, which will be very useful in the medicine department in various branches like oncology, neurology, and some other cardiology like that. So now, how we are getting diagnosis? So it is diagnosis by the hot and cold spots. What are hot spot and what are cold spot? Simply, the area which is active is known as hot spot. It shows bright. The area which is having a less energy is less active, then it is called cold spot. Compared with the normal cell, the cancer cells are very active because of the glucose metabolism. It absorbs more radioactive tracer and it looks very bright when compared to the normal tissue. And hence, it can be classified in can be diagnosis easily the normal cells and the cancer cells. So it absorbs more radioactive nuclide and it appears very bright. So Another thing is given as a caution. If all the tissue it is getting absorbed cannot be a cancer tissue because hypermetabolism may be due to some other reasons also. What are the reasons other than the malignant? Other than malignancy, there may be a benign tissue, inflammation, and infection. Due to these factors also, the hypermetabolism can take place. So it is not 100% sure that if it shows a hypermetabolism, definitely it should be a cancer tissue. It may be due to the benign tissue, inflammation, or infection. And nowadays they are having the color code. In the color code, red means the area which is having the high metabolic activity. Yellow means somewhat high, very high is red, and high is denoted as yellow. Green is the moderate thing or average thing. Blue is low metabolic activity. Gray and black shows there is no metabolic activity. So by seeing the color code, we can easily identify whether the metabolic activity is very high, high or average or low. So in this basis, we are identifying whether the tissue is uh, affected by the cancerous part or not. So these are also some of the images shown. It shows the coronal plan of the CT used with the PET images. It shows the refugee uptake in the peripheral abdominal mass. So this is another example. So this figure it is shown clearly the pulmonary node. The SPM is in clearly the fused image. Now we are coming to the advantages. What are the advantages of the PET-CT? This PET-CT image in the entire spectrum of the cancer care, from diagnosis to the evaluation of the treatment response. Mostly, even the diagnosis is possible in some other modality, but the treatment response, it is very well diagnosed in the PET-CT. What is the treatment response? Suppose a patient who is having the cancer is getting treated. Whether the response is there or not, whether the particular treatment is suited for that particular patient or not, it can be seen by the follow-up scan of the patient. Okay, so that is the follow-up is very much needed in the case of cancer patient getting treatment. So that can be done by the PET-CT. So there is a major advantage. And also it has been proven particularly valuable in early diagnosis. Most of the diagnosis it may be we may be finding out in the later stage, but in the PET-CT it can be find out very early stage. So there is a major advantage of the PET-CT. Disadvantages is it is there always. Disadvantages will be there. What are the disadvantages? So it is expensive. It has a relatively low spatial resolution when compared to the other scanning procedures. And also the patients take more time to take. Okay, so all those things are there. This is considered as a disadvantage. Now we are coming to the PET MRI, the another imaging modality. In this, already we have seen about the PET, how the image is getting formed. A quick review how the image is getting formed in the MRI. In the MRI, in the magnetic field, that is in the field of magnet, the radio frequency coil is giving the radio frequency wave. That radio frequency wave getting interacted with the patient, and it is getting received by the radio frequency coil. That the received radio frequency waves are then converted into readable image by the computer and data acquisition system, and we are getting an image of the MRI. So now the MRI principle, the PET MRI fusion. What is PET MRI fusion? The scan modality that combines the positron tomography and also the MRI scan. Previously, we could not integrate the PET MRI for simultaneous scanning because of the MRI powerful magnets interfere the imaging detector of the PET scanner. After that, the PET and the MRI has been combined together. So there is lot of challenges when putting the PET gantry with the MRI gantry. It's a complex process. It will take step by step. So first, this is the method where the PET is kept separately. It is a PET gantry. PET gantry is kept separately, and this is the MRI gantry. It is kept separate. It is not linked. After getting the image data, both the data are sent to the computer where the image is getting fused and to form a what is called a fused image. Later, there is a modification. See, in this, some of the component of the PET, some of the component in the PET is getting combined with the MRI component. Some of the components they are kept separate. In this case, what are the components inside the MRI? The scintillation crystals are kept inside the MRI gantry, and the components, that is the PM tube, the electronics, and the optical fiber are kept outside the gantry. So that is the second step of the evaluation of the PET MRI. In the first step, the gantry is kept separately. In the next step, some of the components it is kept inside, and some of the components it is kept outside. So that is the second thing. So next evaluation. Here again, the components, the scintillation crystals, and are placed the scintillation crystals and the RF shielded avalanche photodiodes. This is FPD means avalanche photodiodes, and some of the electronics are placed in the gantry itself. That is in the MRI gantry itself. Okay, only some of the axial coaxial cables are keeping out, and it is getting connected to the MRI data acquisition system to form the image. And nowadays there are some special type of photodiodes available where the photodiodes can be placed inside a single gantry. The magnet, that is the MRI gantry, and the PET gantry can be constructed as a single gantry. There, the MRI components, what are the MRI components? The magnet, gradient coil, and the PET components. What are the PET components? The photo multiplier tube, the optical fiber, the scintillation crystals. Both these components can be placed inside a single gantry. So that is the development of the PET MRI nowadays. So the integration of RF component and the silicon photo multiplier tube with the optical fiber output RF shielding of PET components. So the RF shielding is done, so there is no problem in acquiring the data of the MRI. So see, these are some of the images which shows the combination of the PET and the MRI. The particular thing, the enhancement is the metabolic activity is very clear. So this is the case of the carcinoma cervix. Is the MRI image, the fused image with the PET MRI. This shows the metabolic activity of the bladder as well as the what you call carcinoma, the cancer cells near the head. It is getting involved. So there is it shows the higher metabolic activity. So because of this higher metabolic activity, the diagnosis can be done very easy. This is another PET MRI image. As usual, some of the advantages there in the PET MRI, no ionizing radiation in the MRI. Simultaneously, multimodality preclinical imaging can be done. Excellent soft tissue contrast. When compared to the PET CT, PET MRI shows excellent soft tissue contrast because we are combining the MRI with the PET, so we will be giving the superficial or can say superior contrast, tissue contrast. As usual, the disadvantage is that initial cost is very high. So most of the institutions they are not preferring MRA. They are not having MRA bed nowadays also. And one more thing, the time of acquisition is very high. It is about 1 hour to take all those things, and a lot of combinations. What you call lot of technical problems may occur due to a lot of components in the single. Now this is the SPECT CT, the combination of SPECT and the CT. Already we have seen about the CT, how the image is getting formed. We are going to see about the SPECT, how the image is getting formed, the SPECT. SPECT is nothing but a cross-sectional gamma camera. You can say it is the imaging modality where we are taking a cross-sectional image, like in the case of gamma camera. A radiopharmaceutical is injected. That is the first step into the body. It travels into the bloodstream and concentrate in the region of interest. So automatically it will decay after some time. It will when it is getting decay, the gamma rays are getting emitted. The gamma rays which is coming out, that is the emitted gamma rays, are getting absorbed by the gamma camera, which is placed outside the gantry, that is the inside the gantry, is getting converted gamma signals into the readable images. It is being collimated and it is reconstructed by using the reconstruction algorithm. Then we are getting a cross section. So this is the workflow happening in the SPECT. So this is the instrument we'll be knowing. It is same as in the case of the gamma camera. Consider this as the patient. After injecting the radiopharmaceutical, the patient is placed in the gantry. From the patient, the rays are getting emitted. That is, the gamma rays are getting emitted. It has been the collimator. The collimator is getting collimated. The emitted gamma rays, and it is guiding to the photomultiplier. So this is called a light guide, the photomultiplier tube. Before that, there is a crystal called scintillation crystal. We are using mostly there is sodium iodide crystal. This sodium iodide crystal converts the gamma rays into light energy. That is scintillation crystal. So the gamma rays from the patient body is going through the collimator and reaches the sodium iodide crystal, where the sodium iodide crystal converted the gamma rays into the light energy. That light photons are converted into electrical signals by the help of photomultiplier tube array. Why it is called array? There are numerous number of photomultiplier tubes are there inside. So it is called array of photomultiplier tube. After that, what happened? The photomultiplier tube, it is releasing the electrical signal. The electrical signals are getting positioned in a computer by the help of two things. One is called positional circuit, another one is called summing circuit. Positional circuit will give the exact area where the signal is coming from, and pulse height analyzer will use how much the strength of the signal it is coming. So by knowing the strength of the signal and where it is coming, the computer forms a image which can be read. That is called a cross-sectional image. So the cross-sectional image is getting formed in a computer by the help of a reconstruction algorithm and the positional circuit and the pulse height analyzer. So SPECT CT, what happened? Both the things, that is the radioactive tracer injection administered to the patient body, it is getting the SPECT image data. From the CT, we are getting the CT image data. So both the things are getting fused by the inbuilt software. That inbuilt software views the image and it will give a single views image. That image can be displayed or it can be recorded. So this is the SPECT CT image where we are getting the metabolic as well as the structural image. As usual, some of the advantages, it will improve the localization of the lesion, diagnostic accuracy, and reduce the false positive and false negative. This is more important. Better differentiation between the normal and pathologic uptake. Enhanced treatment plan monitoring. It is very much useful in there is MSK, musculoskeletal imaging, cardiology, oncology, neurology, and endocrinology. There are also some of the limitations, the radiation exposure, motion artifact, the cost, and the technical expertise required to operate all these things, modalities. Now, let us, we are introducing our imaging department is now introducing the ultrasound fusion. In some of the hospital, they are practice now. What are the fusion imaging by the ultrasound? All the imaging modality can be combined with ultrasound. That is CT, MRI, PET, SPECT. All these modalities can be combined with the ultrasound. That is the latest fusion technique now they are using. It will use the powerful technique. It will use the or enhance the diagnostic accuracy, particularly in the interventional guidance. We are doing some of the interventional, what you call image guided biopsies, image guided drainage. For all the cases, mostly we are using the ultrasound. But nowadays, they are getting the fusion image of the ultrasound along with the other modalities, namely ultrasound CT, ultrasound MRI, ultrasound PET, and ultrasound SPECT. The common workflow in all these categories, how the image is getting, how the combination image, how the fused image is getting formed in the case of ultrasound fusion. The image acquisition and the pre-processing is done in the first step. In the next step, the image registration and the spatial alignment of the images taken place. And the third step, the real image fusion is done. And then the real time tracking interventional guidance is done. One by one, we will be seeing what are the steps. First one is image acquisition and pre-processing. It is nothing but the type of modalities. If it is a CT, MRI, PET, or SPECT, all the images has been stored in the DICOM. Okay? So that images has been acquired by the particular system. So the images already taken in CT, MRI, SPECT has been acquired. Okay? These images are then loaded into ultrasound system for fusion. So the images already we have taken by using CT, MRI, PET, or SPECT has been loaded in the ultrasound system. Okay, and ready for the fusion. That is the first step. In the second step, image registration. What is image registration? It is the process of aligning two different imaging modalities into the same spatial reference. So it means we are to give the correct position. This is done by using rigid and non-rigid transformation algorithm. How it can be registered reciprocally. Now, there are four types of registration. What are the four types of registration? One is called automatic registration. It is AI based. Second one is called manual registration. The operator selects the common landmarks. Okay. While the doctor is going to select some of the area where he wants the fusion image, he has to select the common area. Okay. And then third one, that is called electromagnetic tracking. In this method, they uses a small electromagnetic sensor attached to the ultrasound probe to track the movements. Okay? And the last one, that is called GPS-like navigation system. Suppose if you want to track motorbike or a car, we are putting a GPS. No? Likewise, we have to put a GPS, external reference points, that probe will track the position. So in all these four methods, the image registration can take place. The next step, once the registry is done, the pre-acquired image is superimposed in the real-time ultrasound display. The fusion takes place. How the fusion takes place? It takes place by the three methods: side by side, adjustable transparency, blending of images, and the third one is synchronized movements. Okay. So first step, we are getting the images which are taken by the modalities, different modalities, CT, MRI, SPECT. Second one, we have registered. Registered means we are tracking the area where the particular image has been taken. Okay. Third thing, we are fusing that particular image taken from CT, MRI, SPECT, or in some other modality with the same area of the image we are taking by the ultrasound. So that is the third step. Real-time tracking and interventional guidance. Some of the systems use positioning sensor on the probe that adjusts the fused image dynamically. The fusion software updates in real time, ensuring accurate spatial correlation between the ultrasound and the other modality. For intervention, I already told you some of the intervention, mostly interventions are taken place, the biopsy, ablations are taking place with the help of ultrasound. So in that case, it is very much used. Key technology used for the fusion, what are the techniques? They are using the three techniques for the fusion. What are the three techniques? One is called electromagnetic tracking. It helps the maintain of alignment between the image planes. The second one is AI-based image matching. It uses the deep learning algorithm for the auto-register image. And third one is called the augmented reality features, that is AR. It uses some system to integrate and improve the perception. What are the clinical applications of the fusion images in ultrasound? Particularly, the liver tumor ablation can be very much useful in the case of ultrasound CT fusion. Prostate biopsy guidance, it is very much useful in the modality, in the hybrid modality of ultrasound MRI fusion. Thyroid and musculoskeletal imaging, that is very well defined in the case of ultrasound SPECT, and oncology PET guided biopsy is done by the hybrid modality of the ultrasound and PET fusion. So these are the, some of the images that this is the ultrasound image, and this will give the fused image. This one, this one the contrast enhanced image of the CT, and this is the ultrasound fused image. We are getting the anatomical and detail very clearly. And this is another one, the biopsy site where it is seen very clearly. So to conclude my talk about the fusion imaging, the key benefits of the fusion imaging include improved lesion localization, enhanced visualization, and better guidance for the intervention procedures. It reduces the diagnostic uncertainty, minimizes the invasive procedures, and allows for the real-time monitoring and therapeutic intervention. However, challenges such as high cost, need for specialized training, complexity of the image interpretation must be addressed to maximum the clinical utility. As technology advances, the artificial intelligence and the machine learning are expected to further refine fusion imaging technique, making them more accessible and efficient. Nowadays, the AI technique is used in all the cases. So if the AI technique emerges very well, that can be utilized for the fusion imaging, and we can get a good hybrid image. And lastly, a few words, that is, be positive always. Every achievement, big or small, deserves to be celebrated. Take a moment to celebrate on your own progress. Share your success with others. A positive mindset leads to even more achievement and progress. So I wish you all the best for all the students and radiographers, and be positive always, and always celebrate your success. Most of the radiographers, they're doing something, but they are not revealing all those things because they think that it is a very small thing. Don't think like that. Okay, be positive always. Even a small thing can be celebrated. So thank you all for the.
If anyone has any questions or doubts regarding this topic, Sir can answer it for you. You can post your questions in the chat box.
Question is there, sir? What are the magnets generally used in PET MRI? Nowadays, we are using the superconductive magnets, and in future they are planning to replace that also.
Any more questions?
If you have any other questions, you can also post it in my WhatsApp number or my mail ID is given in the display.
It seems like there are no more questions. Thank you, sir, for sharing your knowledge with us.
Thank you, madam. Thank you very much for giving me the opportunity.
However, your in-depth explanation of how combining different imaging modalities enhance diagnostic accuracy and improves patient outcomes was incredibly enlightening. I'm sure the participants have a clearer understanding of how these advanced techniques allow for better visualization of both anatomical and functional information, leading to more precise diagnosis and treatment planning. Thank you once again, sir, and I thank all the attendees for your active participation. Before we conclude, let me briefly inform the participants about the next session tomorrow. We will have with us Mr. Kaushik Nayak, Assistant Professor in the Department of Medical Imaging Technology, Manipal College of Health Profession, Mahe, Manipal, Karnataka. He will be talking on the topic low dose CT, strategies for optimizing image quality and safety. See you tomorrow at 11 a.m. Until then, stay safe, take care, and have a nice day.